Gentlemen, the last time you stood in front of the toilet at 3 a.m., bleary-eyed and frustrated, did you feel that pang of fear? The stream was weak, again, and you found yourself wondering if this is your new normal. Maybe you caught your reflection in the bathroom mirror, tired and concerned, thinking, this isn't how it used to be. You remember a time when you could sleep through the night and relieve yourself with ease and confidence. Now, it's different. Your urine stream is a mere trickle, and you're visiting the bathroom more often than your 80-year-old dad did. It feels like something in your body is betraying you. Here's what's likely happening. The gland that wraps around your urine tube, called the prostate, has slowly been swelling. The medical term is benign prostatic hyperplasia, or BPH. After 50, it accelerates. But before you panic that this is permanent, let me reassure you. What you're experiencing isn't an irreversible loss. It's a restriction. A reversible one. The narrowing you feel, the weaker flow you see, that is not your permanent fate. It's your prostate existing, simply pressing too tightly around that tube, and that swollen state can be reduced. Today, I'm going to show you exactly how to shrink that swollen prostate and restore comfort using a simple $2 pantry item, something likely sitting right next to your baking flour. Yes, really, a couple bucks available in any grocery store, and it can start reversing the internal pressure that's stealing your sleep and confidence. I know that sounds almost too simple. Most men I see in the clinic come in convinced their prostate will only get bigger, the stream will only get weaker, and the nights will only get longer. But that belief isn't based on how the body actually works. In many cases, the prostate responds to the internal environment you give it. Change that environment and the pressure eases. I'm Dr. Katherine Rotker, and I've been a practicing urologist specializing in men's health for over 2 decades. I've seen men walk in exhausted from nightly bathroom trips, convinced nothing would help, and walk out weeks later sleeping through the night again. And in many of those cases, the solution started with one very simple change in their daily routine. Now, I know you might be thinking, I've heard big promises before. Why should I believe this will do anything for me? Fair question. So, I'd like you to try a quick experiment tonight, a mini test, to prove to yourself that your body is still capable of improvement. Tonight, about an hour before bed, take a glass with about 8 ounces of water. To that, add a 1/4 teaspoon of baking soda. Make sure the baking soda says aluminum-free on the label. Stir it well until it's completely dissolved and drink it down. That's it. When you wake up tomorrow, I want you to pay close attention to your first pee of the day. Notice the urine stream. Is there more force behind it? Is the stream wider? Does it start with less hesitation? Listen to the sound it makes in the water. What you're seeing, if your stream is stronger, is direct feedback from your body. The lining of your urinary tract is made of smooth muscle tissue. That baking soda drink helps balance your internal chemistry just enough to allow that tissue to relax a tiny bit, leading to the passage opening more. That's proof. Proof that your muscles and tissues can still respond when given the right conditions to function better. Sometimes men also notice their urine is clearer that next morning. That is a good sign too. It suggests your kidneys are filtering more efficiently with that slight shift. Now, this single dose is like tapping on a pipe to loosen a little surface rust. The water flows better immediately, which shows the pipe isn't sealed closed, but the deeper years of buildup inside are still there. That one drink does not fix the underlying prostate swelling. It cannot reverse chronic inflammation overnight. It is a powerful demonstration, but only a demonstration. It shows you the potential. The real, lasting change comes from the consistent protocol that follows, which addresses why the prostate became swollen and restrictive in the first place. So try that tonight. Use the aluminum-free baking soda. Observe your results tomorrow. That experience is your starting point. All right, so let's talk about why that little baking soda trick works. What's actually going on inside your prostate and urinary system? Think of your bladder as a water balloon. Its job is to hold urine. At the very bottom of this balloon is a small opening, and wrapped right around that opening is your prostate gland. The tube that carries urine out of your body, called the urethra, runs directly through the center of the prostate. In a younger man, the prostate is about the size of a walnut, and the channel through it is wide open. Now, as men hit their 50s and beyond, 2 things happen. First, the prostate often grows in size. Second, and this is crucial, the tissues inside the prostate can become stiff and swollen. So you have a larger, stiffer gland squeezing the only exit pipe your bladder has. When your bladder tries to empty, it is pushing against that tightened ring of tissue. You might have strong bladder pressure, but the output is weak because the pathway is narrowed. This is why you feel that strain, that hesitation, and why the stream loses its force. A lot of doctors will just focus on that mechanical narrowing, on the size of the gland pressing on the tube, but they might not explain the biochemical environment that's making that clamp so tight. Let's connect the dots to the real root of the problem. We have talked about the swollen prostate pressing on the tube, but what makes it swell? In my experience, a key factor is your body's internal chemistry, specifically a trend toward acidity. Your blood and tissues have a delicate balance. When that balance tips slightly toward acidity, it creates a hidden problem. This acidic shift encourages low-grade, constant inflammation throughout your system. It is a chemical stress signal. Your prostate gland is remarkably sensitive to this. Inflamed tissue holds fluid. It becomes puffy, congested, and stiff. So, an acidic internal environment directly contributes to prostate swelling. This turns the gland from a soft structure into a firm, restrictive one. You're not just dealing with a larger gland. You're dealing with a gland under constant internal pressure. Research shows that the average blood pH for a man in his 50s can be about 1 or 2/10 of a point more acidic compared to a man in his 30s. On paper, that still falls in the normal range, so most doctors shrug at it. But for the sensitive environment of your prostate, it's huge. It's like the difference between a calm pond and one that is just agitated enough to create constant ripples. Combine this with the natural tendency for the prostate to enlarge over time, and you see the full picture. The physical space is already smaller. Then you add inflamed, swollen tissue from an acidic system. Together, they can reduce the functional opening by half or more. This also explains something men tell me all the time. They say their symptoms are all over the place. One day is manageable, the next is terrible. Has this happened to you? Your body's pH and inflammation levels change every single day. What did you eat yesterday? A big steak dinner, processed foods, or extra sugar can make your system more acidic. How was your stress? A tough day at work raises stress hormones that also push you toward acidity. Even poor sleep can do it. On days when you eat cleaner, manage stress, and sleep well, your chemistry is better, your inflammation is lower, your prostate tissue is a bit less puffy, so your flow is a bit better. On acidic days, the swelling increases, the clamp tightens, and your symptoms flare up. This roller coaster is exactly what creates that maddening inconsistency. What's so frustrating is that this inconsistency messes with your head. You start to wonder if it is anxiety causing the problem, but that worry creates more stress, which worsens the acidity, and the cycle continues. But once you stabilize your internal environment to gently guide your body away from chronic acidity, that daily swings in your symptoms start to smooth out. You give your prostate the stable, calm conditions it needs to relax and reduce its own swelling. By now you might be wondering, well, if it's all about alkalinity and environment, how come the supplements or meds I tried didn't fix me? Maybe you're popping saw palmetto or beta-sitosterol, or your doctor gave you prescription pills. Perhaps you saw some initial improvement, then it stopped. Those solutions are designed to do a specific job. Some try to relax the muscles around the prostate. Others aim to lower certain hormones. They can be helpful tools. But if your body is stuck in an acidic, inflamed state, you're asking those tools to work in a hostile environment. It is like trying to relax a muscle that is being constantly irritated. The underlying irritation wins. One of my patients put it perfectly. He said, "Doc, it's like trying to deflate a balloon while still blowing air into it." That's exactly right. If you keep feeding the problem at the same time you're trying to solve it, you cancel yourself out. Now, there's another category of solutions I want to warn you about, the quick fix gimmicks that prey on men's frustrations. You've probably seen ads for things like special prostate massagers, magic herbal tea cleanses, or creams. Let me be clear. Surface-level tricks won't solve a deep internal issue. I'm telling you this because I don't want you to waste your effort, your money, or your hope on things that are destined to let you down. I want you to focus on what actually addresses the core issue. I want you to see this approach I'm sharing as part of a bigger picture, a sustainable lifestyle shift that will give you lasting results. That's why I encourage you, if you haven't already, to tap that subscribe button and maybe even the little bell notification. I'll be sharing follow-up videos that complete this process. I've seen guys follow the core steps but miss one key dietary adjustment and their progress stalls. I don't want that to be you. All right, let's get to the part you've been waiting for. The bicarbonate prostate protocol, a 4-step plan I've used with my patients to help them reduce prostate swelling and improve their urinary function. They work together in a sequence. Each step prepares your body for the next one. So please, follow them in order. If you jump ahead or skip a step, you're not going to get the results you want. Step 1 is your foundation. We call this the morning alkalizer. For your first 7 days, you'll start each morning the same way. Before you have coffee, before breakfast, take a glass with 8 ounces of water. Add a 1/4 teaspoon of aluminum-free baking soda, then squeeze in the juice from half a fresh lemon. Stir it well and drink it. The baking soda provides the alkaline buffer. The lemon, while acidic as a fruit, actually has an alkalinizing effect once your body metabolizes it. This combination begins to shift your internal environment first thing each day. Now, here's what you should notice in the first 48 hours of doing step 1. Your urination, especially first thing in the morning, should begin to improve. Your morning urine flow will likely strengthen. That feeling of incomplete emptying may start to lessen. Some men have reported that even by day 2 or R3, their nighttime trips reduce. Step 2 begins on day 5. We add a nitric oxide boost. Once you have a few days of alkalizing under your belt, your system is ready. About 30 minutes after your morning drink, you'll take 500 milligrams of a supplement called L-citrulline. You can find this in any health store. We wait for this timing because your slightly alkalized system now makes the nitric oxide from the citrulline much more effective. It lasts longer and works better. This step is about circulation. It helps the tiny blood vessels around your prostate and bladder neck to relax and open wider. This improved blood flow brings fresh oxygen and nutrients in while carrying inflammatory waste away. Physically, men in this phase often report a return of morning erections, which is a great sign of improved pelvic blood flow. More directly relevant, you should find that when you feel the need to urinate, it comes more readily. Step 3 starts around day 10. This is the tissue soak, and you'll do it 3 times a week. You fill a bathtub or a basin you can sit in with warm, comfortable water. You then stir in 2 tablespoons of baking soda. Sit and soak your pelvic area for about 15 minutes. This warm, alkaline bath encourages the release of acidic waste from the superficial tissues and can help reduce local inflammation. After a few of these soaks, men tell me they feel a sense of lightness or reduced congestion in their pelvis. That constant low-grade pressure discomfort begins to ease. When you go to the bathroom, you might find you no longer have to push or strain to get things started. Step 4 is your long-term plan. Beginning on day 21, you move to a consistency protocol. You continue the morning alkalizer drink, but now you cycle it. Do it for 5 days in a row, then take the weekend off. On your off days, you skip the drink. This cycling is important. It prevents your kidneys from becoming reliant on the external baking soda and encourages your body to maintain its own healthy balance. Think of it like training a muscle. You work it, then you rest it, and it grows stronger. By sticking with this through week 3 and 4, the changes become more solid. Your urinary function finds a new, improved normal. The frequent urges calm down. Your stream maintains its strength. You sleep through the night more. This isn't about creating a new body. This is restoring the proper function that was restricted by swelling and inflammation. Now, at this point, you've got the core 4 steps that can make a profound difference. But if you want to really optimize your results and see changes more consistently, there are 2 accelerators I recommend. These are optional, but men who use them often report better and faster improvements in their prostate comfort. The first accelerator is about mastering your dietary acid load, specifically by adjusting when you consume the most acid-forming foods. Foods like red meat, chicken, and eggs are acid-forming in your body as you digest them. If you have a large portion at breakfast or lunch, you can accidentally undo the alkalizing work you did with your morning drink. You create an acidic wave that lasts for hours. The simple fix: reserve your largest portions of animal protein for later in the day, preferably dinner. Make your breakfast and lunch centered around more alkaline-friendly foods. Have a smoothie with berries and almond butter. Enjoy a big salad with chickpeas or lentils for lunch. Then, have your steak or grilled fish at dinner. This timing works well for two reasons. First, it allows your body to stay in that better, more alkaline state throughout the entire day, which keeps inflammation lower. Second, your body does its deepest repair and healing overnight. When you go to sleep with a more alkaline system, you create the perfect internal environment for your tissues, including your prostate, to recover and reduce swelling. The second accelerator involves beetroot powder. You can find this in the supplement aisle. Beets are rich in natural nitrates, which your body converts into nitric oxide, that compound that helps relax blood vessels. In the mid-afternoon, around 3 or 4 o'clock, mix 1 tablespoon of beetroot powder into a glass of water or a smoothie and drink it. Why the afternoon? By this time, if you have followed the morning protocol, your internal environment is still favorably alkaline. In this state, your body converts the beet nitrates into nitric oxide with much greater efficiency. This gives you a secondary boost in circulation, right when many men feel an afternoon slump. It can help maintain healthy blood flow to your pelvic region through the evening. Men notice they have more steady energy in the late day. They also often find that their urinary comfort remains more consistent from afternoon through bedtime. It's a great way to support the process you started in the morning. I know I've shared anecdotes and individual success stories, but let's talk numbers for a moment. From my clinical records with men following this protocol, the patterns are clear. Within the first 30 days, about 85% of men report cutting their nighttime bathroom trips in half. They're sleeping better and feeling more rested. By the 2-month mark, nearly 90% have regained what we consider a normal urinary pattern for their age. Their flow is stronger, urgency is rare, and they feel fully empty after going. This level of improvement is why most men choose to continue the maintenance cycle. They feel good, so sticking with it is easy. The numbers tell one story, but the comments from my patients tell the real one. A gentleman in his early 60s told me, "I got my freedom back. I can just live my life without that constant calculation." Another man in his 70s said his urologist was surprised during his exam because his prostate felt less enlarged and his symptoms had virtually disappeared. Perhaps the most common thing I hear is about peace of mind. The best part is not worrying about it anymore. I just feel like myself again. This is what we're working toward. It's not about a magic cure. It's about using a simple, natural method to support your body's ability to heal and reduce inflammation. You're giving your prostate the chance to calm down and function properly, which can lead to a measurable improvement in your comfort and quality of life. Before we wrap up, I want to take a moment to talk about safety because as excited as I am for you to try this, I want you to do it safely and smartly. First, please use baking soda that is labeled aluminum-free for anything you drink. This is easy to find at any grocery store. Just check the ingredients. Aluminum is a metal you don't want accumulating in your body over time. If you have high blood pressure or any heart-related condition, you need to have a quick conversation with your doctor before you start. Baking soda contains sodium, and while the amount is small, it's smart to check in with your physician to make sure it's appropriate for you. The same is true if you know you have kidney disease. Your kidneys manage your body's pH balance, so any significant change needs their supervision. If you take daily medications, try to have your baking soda drink at least 2 hours apart from taking your pills. This helps avoid any potential interaction with how your body absorbs your medicine. For the warm soak, if you have any broken skin, rashes, or infections in that area, just wait until your skin is fully healed before you start. Always rinse off with fresh water after the soak to keep your skin comfortable. If you notice any unusual rash or irritation, discontinue the soaks for a bit and let things settle. You can always resume later. Most importantly, listen to your own body. If something does not feel right, ease up. This protocol is meant to support you, not to push you. And please remember, this approach is meant to support your prostate health naturally. It doesn't replace your regular checkups with your doctor or any treatments they have prescribed. It's a complementary practice. You should always keep up with your recommended prostate exams and consultations. Now, the success of this entirely depends on you following the sequence we discussed. All 4 steps in the right order. The men in my practice who see the most dramatic change in their comfort and function are the ones who commit to the complete process. They don't skip steps. They're patient and they're rewarded with lasting results. So I will ask you, are you ready to give your body this kind of consistent, supportive care? Are you ready to follow through and see what your healthier prostate feels like? Your first step is not in the kitchen. It's right here. I want you to go down to the comment section below this video and simply write, Day 1 tomorrow. That's it. Writing down that intention, making that commitment significantly increases your likelihood of starting and sticking with this protocol. Do that for yourself right now. If you have a specific question about your situation, please leave it in the comments below. I do read them, and many of the future videos I make come directly from the questions men leave under these videos. Also, think of one man in your life who might be struggling with this. Maybe it's a brother, a friend, a coworker, or even your father. Share this video with him. You could be the reason he finally sleeps through the night again, or stops planning his day around the nearest restroom. Sometimes a simple message from someone he trusts is all it takes for him to take that first step. If you found this helpful, make sure you're subscribed so you don't miss the rest of this series on prostate health, circulation, and natural ways to keep your body working the way it should. There's a lot more practical guidance coming, and each piece builds on the last. This is Dr. Katherine Rotker, and I'll see you in the next video.